each and everyone, as long as we are really, really strictly adhering to the most important requirements right now, wherever you are living in the globe, particularly in Sri Lanka. We are really, really boasted very much the mitigation efforts we have successfully implemented and really, really heeded to the requirements of the authorities. And in the meantime, in the recent past, according to our experience, we are really, really emphasizing furthermore on the aspect just to keep everything under control, because any slightest mistake will really trigger just to bring about great outbreaks of the COVID-19 expansion in Sri Lanka. So, Doctor, we are talking immensely on various terms, various ways, and various aspects of this particular menace right now. So, Dr. Amanthi, as a consultant community physician, I'm sure that you're always dealing with the community in terms of observing the developments. And can you explain our listeners about particularly the current situation, the evolving situation, and the response of the community people, and what kind of further steps they should just follow to just keep everything under control according to your view right now on this program, 11th Hour Radio Sri Lanka?
Yes, thank you very much. We have been having a lot of COVID cases. We have been, where Sri Lanka was having the situation well under control. And we were very happy about the situation, but unfortunately there was a second outbreak, which was first identified on the 4th of October, where there was a cluster identified from Minuwangoda. And after that we have been seeing that this cluster is expanding with further patients being identified and their contacts also testing positive for COVID. And we have seen that this cluster has expanded beyond Minuwangoda, and now we are seeing cases from various districts and parts of the island. So we have cases actually from 21 districts in Sri Lanka. But the good thing about this is that we can trace, because our health and the security forces have been very vigilant and been tracking these cases and identifying as many contacts of these people as possible. So we can say that there is still a definite way of being able to trace the origins of how they got this disease. So it is not, we cannot say that it is really out of control. I know there is a lot of concern that there is community transmission, but I think what we have to draw the line is very fine actually between these large clusters occurring and the community transmission. So according to the definition, if we go to community transmission, what it does say is that there are large numbers of people, clusters, which we cannot trace. They are not identified with each other. So we have not officially reached that state yet, because we are largely able to identify the vast majority of these contacts and cases and find links between them. Of course, there may be a few. There are still a few where we cannot say definitely how they did get it, but we cannot yet say that there is community transmission. But personally, what I feel is we really don't need to stick to these definitions. Are we in community transmission, or are we having a large-scale cluster outbreak? No, whatever it is, our behavior as a general public and the precautions we need to take remain the same, irrespective of whether this is at outbreak level with clusters which are interconnected or whether it is community transmission. The preventive actions that we need to take remain unaltered. So we have to take these precautions at all times.
That is a very good message indeed. According to the past, the whole throughout the history of this particular outbreak since December from China, indeed, almost all the regimes and particularly the health authorities, including the United Nations Health particular segment, is tremendously thinking innovative ways just to keep everything under control. But the inability to just find a permanent solution in terms of a vaccine is what really hesitating each and everyone right now. In the meantime, until find that particular solution, the innovation, the various methods followed by various territories is very important. And we have seen certain areas where people have really managed in a very, very satisfactory way, but still, time to come, they find certain difficulties just to unexpected, unprecedented outbreaks. So that is what we experience here. And this can continue, Doctor. What is your idea? If it continues like this, now it can be a silent period for quite some time, according to the important behavior patterns that our citizens are following. But it can once again emerge. So that rests particularly in the authority of your particular attachment, like community responsibility is concerned. So how do you look at that? How do you just advise the people in that category?
Yes, thank you. That is a very important question. So what we do need to ensure is that as individuals, as communities and as societies, we fulfill our complete responsibilities in protecting ourselves, our families, and all our workplaces and our communities from COVID-19. So this is actually entirely within our control. So how do we do this? We have to strictly adhere to the health guidelines that have been given by the Health Ministry. So I think one of the key concepts here is the DREAM concept. So DREAM, actually the D stands for physical distancing. So physical distancing is of utmost importance. There should be at all times a distance of 1 meter maintained between individuals. So there are certain places where this is not applicable, like in public transport, which I will come to later. But wherever in the workplace, in public places like in markets, supermarkets, banks, etc., where we do have to go for our essential day-to-day needs, this 1 meter physical distance is extremely important. And I want to emphasize that this is physical distancing, not social distancing. Because there is actually a difference between physical and social distancing.
Which really triggers pretty much this stigma type of mentality in the community. So that is my next question, Doctor. Like this, as far as a person who really proved that he is convicted, he is really contacted and under this particular important COVID-19 infection. So if someone being detected at that status, the panic and the mentality of the family members and the society backgrounds, these really make a great impact on their day-to-day lifestyle. And in the meantime, the threat is always there. So under that circumstances, what is your opinion? How you just guide these listeners?
Well, the stigma really needs to be removed from this whole scenario, because this is really preventing people from coming up for treatment. And what we have to always remember is that this disease is nobody's fault. It is not your fault or that particular person's fault, however vulnerable the community they may be from, that they have contracted this disease. It can happen to you, it can happen to me. So we have to be always aware of that and not make this a fault-finding mechanism. So that is message number one. And whoever is infected with this, it has been beyond their control largely. So we must do our utmost to help them. If there is a family that is in quarantine, we do not stigmatize them. We do not treat them as outcasts. But we do our best to support them within our capacity. Maybe we can make sure that they do get their day-to-day needs. If they need food items, as good neighbors, we can go and leave it at their doorstep. Or we can be supportive. In our culture, we have always traditionally been a very hospitable kind of community and nation. So I don't see why this has to kind of end with corona, because we are renowned for our hospitality, sharing, looking after people. So this is extremely important that we do not stigmatize anybody, because because what is going to happen with stigma is that people are going to hide the fact that they have symptoms. They're going to hide that they're ill. They're not going to come up for treatment, and this is actually going to cause this to spread very much more. But if we do not blame them, if we do not treat them as outcasts, if we are completely sympathetic and supportive while maintaining all the precautions to prevent getting this disease from them, well, it's a win-win situation for all.
Exactly. That is the point what we are really, really emphasizing pretty much today. Indeed, people like in a top caliber, like President of United States, Donald Trump, if he contracted this, and the iconic people like Amitabh Bachchan contracted this, and you can name a great large list indeed. And in the meantime, the most poor and most suffering economic background people too contracting this. So this is a common thing. So most important thing is the mindset of the community people who are really, really engaged in uplifting the human beings' welfare. So that is the fact we have to concentrate. And this is really a testing time for almost all the communities across the globe, just to bring out the right kind of humanitarian assistance and the humanitarian kindness to just overcome this. And in the meantime, I'm just deviating from the community aspect of this particular discussion, Doctor, right now. Now, we are constantly talking about the PCR tests. And people I know pretty much know by this time what is PCR test. And in the meantime, what is the current situation? We're talking about number of PCR tests to be increased, and there are instances we find at the first test someone proved positive and the second test is proved negative. So can you just come out on that particular aspect?
Yes, well, PCR testing is very important in controlling and preventing the transmission of this disease, because it does help to identify those who are affected. And with contact tracing also, it is very important. But it is not a 100% accurate test. That we have to keep in mind. So this is one of the key reasons why we get positive tests followed by negative tests. What the PCR test does is it identifies parts, genetic material of the virus, of the coronavirus. And if that is there in that sample, which is taken from the nasopharynx and the oropharynx, or from our respiratory secretions, well, if it is there in that sample, then we do get a positive test. But this positive result is more common with higher viral loads or higher secretion. But as the person's immunity builds up, well, then the viral components which are in these samples would get less. So then subsequently we might get a negative test as our body fights this virus and our immunity builds up. And secondly, we have to remember that this is not a 100% sensitive test. That means that not all who have COVID-19 are going to be identified as having COVID-19 by this test. There are always those who will have the test, though it is a small number, who will not be identified. So unfortunately, we see that sometimes this PCR test is being used as a kind of insurance policy. People are demanding that they get tested and then they think, okay, I have a PCR negative report. That means I can attend a social function. I can go anywhere. I am negative. There is absolutely no risk of me having this disease or transmitting it to anybody. So no, this is wrong, because as we said, there are two reasons. One is that, well, if your immune system is good or if you're asymptomatic, that means you may be infected but you do not show the symptoms. You're not having a cough and such. Then also there are chances that it could be negative. And also because it is not a 100% sensitive test, it will always not be positive, even though you may be infected. So this is not an excuse to go around saying, because I am PCR negative, it is completely safe for me to wander around in the community. I am not at risk. I am not a risk to others. No. So that is the key message that I want to convey here, that we have to always adhere to that dream concept behaviors of physical distancing, proper hand hygiene, respiratory etiquette, wearing face masks, because all that is very much more important than the result of a mere test.
That's a great message indeed, because we must always think a better way just to follow in which way that we can come out of this situation. And as Doctor mentioned, we are so fortunate enough at least to have a test kind of PCR right now, just to screen these people who have contacted this COVID-19. And in the meantime, the positive and negative views in terms of what is really really spreading in the society is completely the difficult part is that, because that is the community way of behavior. Because the real aspect is one thing, and the message created by the minds of the people according to the social behavior patterns, they are really taking a different way. So to just bring everything in a very, very standard level, just to keep everything under control is very important. So as Doctor mentioned, it's very important just to keep ourselves adhere to a dream or assumptions based important health area we should always maintain. So that is the important thing. And Doctor, before we move on to the next question, it's 20 minutes down 11 o'clock right here on Radio Sri Lanka. You're listening to the 11th hour, a live interview program with Dr. Amanthi Bandusena, the consultant community physician of Health Promotion Bureau. Yes, continuing the questions, I'm sure if I just open up my telephone line just to bring out the questions, I'm sure we will be inundated today, because how far these electronic media and the print media and the communications divulging personalities are informing, bringing the information to the community, and they still have some clarifications to be done. And Doctor, just stationing at that point, how do you just advise our listeners to just conducting the normal functions? Like we have as a community, we have wedding functions, we have to just organize in time, and in the meantime birthday parties and get-togethers, and particularly unavoidable this funeral arrangements. And when you take these important aspects of under these circumstances, how we can guide these people just to conduct this? And particularly as a Buddhist majority-based Sri Lanka, we have these alms givings, dana preparations, and of course we used to converge people to homes to do certain alms-giving programs. How do you just guide under these circumstances our listeners?
Well, yes, life does have to go on, because this is not a problem which is going to end in 1 week or 2 weeks. We are looking at quite a long-term kind of situation. But whenever possible, I think it's always best if we can postpone an event, because especially at times like this where we are having an outbreak, if it's possibly feasible to postpone that event for a bit later, that would be ideal. Otherwise, if we are having to go ahead with the event, as you mentioned, we may have a funeral. Okay, we have to definitely go ahead with the funeral. Once again, what we can do is to limit the number of people who are coming into the funeral house as much as possible. And within the funeral house also, all these preventive practices do have to be maintained. The physical distancing of at least 1 meter. We cannot have the whole house or venue crowded. Hand washing with soap and running water, that is extremely important. Before we do enter the premises, we must always wash our hands with soap and water. And having hand sanitizer also available wherever possible. Then the respiratory etiquette, where we do not just cough and sneeze. We have to either cough into a tissue and dispose of the tissue properly in a closed bin, or we have to sneeze into the crook of our elbow, where we do not have a tissue. But of course, now with the public gazette also, which has been put out, the wearing of face masks is compulsory. So in any situation where we do go out into the public, whether it is a funeral or an almsgiving, or any such situation as you just mentioned, wearing the face mask is absolutely compulsory currently. So sticking to these guidelines, we can prevent transmission of COVID to a large extent. But I repeat, wherever possible, we should try to minimize the social gatherings and attending the social gatherings, and wherever they are held, limit the numbers as much as possible while adhering to all the health guidelines.
And slightly taking this particular point into something similar to that, like taking care of our children at home. Now, it's not the common time what we are passing right now, because the children, of course, they had a great important time just enjoying outside with their friends, riding bicycles, playing cricket in the ground. How do you just guide them at this situation?
Well, we cannot confine children to the house and keep. It's a bit of a difficult situation for them with the schools also being closed. So I think in the open air places with adequate physical distancing, they can continue walking, running about. So we do see people are still using the walking tracks. Kids are cycling. Those things can continue. But what we have to make sure are that the more vulnerable people, the grandparents in the house, for example, are protected. So it is always best to maintain this physical distance wherever there are the elderly grandparents also living as an extended family. Now, this is also very common in Sri Lanka. So, like life goes on. So the kids do have to have, they cannot be confined to the house at all times, no. So while adhering to the safety guidelines and going about their exercise and things like that, what they have to make sure is that they do not bring any infection back home to the elderly who may be there. So once again, the hand washing practices, all those personal hygiene mechanisms which we are advocating are really essential in this kind of situation. But yes, kids do have to go out and play and that kind of thing. In our own garden, they can definitely do a lot of things. And I think we can use this time to build family bonding, to have good quality family time together with our children. There are so many things, positive aspects of this that we can bring about.
That's a great notion indeed, as far as the children are concerned and the elderly people who are really, really living with an extended family is concerned. And in the meantime, my next question, Doctor, this is really a conflicting question indeed. Now, in a society, people really, they have their own faith way of beliefs, like Christianity, Buddhism, Muslim, Islam, and on various things. And this is really a inherited cultural base where people don't take much interest to deviate from their routine practices to attend their routine prayers or attending the religious functions, which really always build up on a community gathering. So right now, or in recent past, after the outbreak of COVID-19, we have witnessed a number of areas as far as the religious centers are concerned, triggered pretty much outbreaks. So how do you guide these particular people who have strange, extensively belief in their, to follow their important rituals as far as their beliefs are concerned? How do you just console them right now?
Yes, well, religious practice and beliefs are an inherent part of our culture and system, and it is an extremely important part of our personal lives. So we definitely do have to continue with our religious practices and beliefs. But the way we practice our religion is what is of importance here, because we do not necessarily have to have gatherings in large numbers at places of worship, at temples, kovils, mosques, churches, etc. Religion is not something which we need to publicize and show outwardly. It is something that we can practice inside. So once again, I think the religious leaders of all these religious establishments also have a key role to play in trying to minimize these religious gatherings as much as possible. And where they do have them, minimizing the numbers that come. And they can also actually play a great role in giving the prevention messages and promoting the practices by maybe just spending 2-3 minutes before they start the function on advising the people on how they have to practice these behaviors, the dream concept behaviors that we did earlier speak about. So that is an important way in which the religious leaders can actually reach all their religious communities and also maybe get the message across to the more vulnerable communities, which would probably be gathering at the temples, mosques, churches, etc., and may not have access to other more sophisticated or electronic modes of communication. So that way, I think the places of worship can be really utilized to promote the COVID preventive behaviors also. But as I said, yes, we should minimize these as much as possible, and we can practice. We don't have to go to the temple to worship. We can always worship in our own home. We can meditate in our own home. We can read about our religion, and the practice of the religion is always more important than the outward manifestations, and I'm sure that applies to all faiths. And I'm sure in all the faiths and scriptures we do get readings that do say that in situations such as this, we can actually all practice our religion within the confines of our homes without actually having public gatherings.
Well, Doctor, it's 30 minutes down 11 o'clock, and we have just come out with various important areas as far as our new norm of this COVID-19 based environment is concerned. It's 33 and a half minutes past 11 o'clock, and listening to 11th Hour, the final part of the program today. Featuring today Dr. Amanthi Bandusena, Consultant Community Physician, Health Promotion Bureau. And as I mentioned, it's going to be the final segment of this particular interview-based program right now. And I like to just draw my attention to a very, very important question that is burning in my mind. In fact, that is in this previous experience from the outbreak that appeared in Sri Lanka till this time around, Doctor, do you have a very special experience that you can share with our people when you try to just deal with this particular COVID-19 patients? Do you have any special, remarkable experience that you can share with our listeners?
Well, I can't recollect one particular remarkable instance, but I do think something is that people are largely knowledgeable. People do know what they need to do to practice, to prevent getting this infection and transmitting it, etc. But unfortunately, for some reason, there seems to be a gap between their knowledge and their practice. So I think what we have seen is that sometimes people think that they may not be at risk. But no, none of us can think that any longer, because we may all be equally at risk. And like I said, we should not stigmatize those who do get it, because it can happen to you and me today or tomorrow. Similarly, we do have the risk of getting this. However careful we personally may be, but if we do practice these behaviors as much as possible, the dream concept behaviors, that will go a long way towards controlling this outbreak and preventing it from going further. And of course, at any point, we do get a lot of queries at the Health Promotion Bureau which come on to our hotline, which is open 24 hours. Mm-hmm. So that is 1-999. So anybody who has any queries regarding this or the practices is most welcome to call our hotline at any time. And we also have the Facebook Health Promotion Bureau page, where a lot of material which may be very interesting on preventing and how we should, and some very nice media campaign material also is available.
It's available.
Yes. So I think these would kind of help to bridge the gap between knowledge and how we do actually practice this in reality.
That is 1-999 is the hotline. Just to get furthermore details all about the always emphasized facts indeed. So if you have any clarifications, further clarifications to be done, indeed you can just reach out on 1-999 and reach the officials of the Health Promotion Bureau and get the details more and more. And in the meantime, Doctor, we extend our thanks on behalf of our listeners and on behalf of our radio crew over here and Indira Navagama, who really make everything happen right now on this program, 11th Hour. Thank you very much, Doctor. That was Dr. Amanthi Bandusena, Consultant Community Physician, Health Promotion Bureau, featuring today on 11th Hour.